Hi everyone, welcome back. On November 2nd of this year, the Centers for Medicare and Medicaid Services or CMS issued the calendar year 2022 physician fee schedule final rule, and let's see how it impacts rural health clinics and federally qualified health centers. CMS finalized several provisions aimed at bolstering the abilities of rural health clinics or RHCS and federally qualified health centers or FQHCs to furnish care to underserved Medicare beneficiaries. The following provisions demonstrate CMS's commitment to addressing health equities in rural and vulnerable populations. Mental health services furnished via telecommunications technologies for rural health clinics and federally qualified health centers. CMS finalized its proposal to revise the current regulatory language for rural health clinics or federally qualified health center mental health visits to include visits furnished using interactive, real time telecommunications technology. This change will allow rural health clinics and federally qualified health centers to report and receive payment for mental health visits furnished via real-time telecommunication technology in the same way they currently do when visits take place in person, including audio-only visits when the beneficiary is not capable of or does not consent to the use of video technology. CMS also finalized that an in-person non-telehealth visit must be furnished at least every 12 months for these services. However, exceptions to the in-person visit requirement may be made based on beneficiary circumstances with the reason documented in the patient's medical record, and more frequent visits are also allowed under their policy as driven by clinical needs on a case-by-case basis. Rural Health Clinic or RSC payment limit per visit. Section 130 of the Consolidated Appropriations Act of 2021 as amended by Section 2 of Public Law 1177 requires that beginning April 1st of 2021 already enrolled independent rural health clinics and provider-based rural health clinics in larger hospitals receive an increase in their payment limit per visit over an 8-year period with a prescribed amount for each year from 2021 through 2028. Then in subsequent years, the limit is updated by the percentage increase in Medicare Economic Index or MEI. Also beginning April 1st of 2021, Section 130 as amended requires that a payment limit per visit be established for most provider-based rural health clinics in a hospital with fewer than 50 beds enrolled before January 1st of 2021 be subject to a payment limit based on their 2020 per visit rate, updated annually by the percentage increase in Medicare Economic Index or MEI. Lastly, Section 130 of the Consolidated Appropriations Act subjects all newly enrolled rural health clinics as of January 1st, 2021 and after, both independent and provider based, to a national payment limit per visit. Payment for attending physician services furnished by rural health clinics or federally qualified health centers to hospice patients. CMS finalized its proposal to implement Section 132 of the Consolidated Appropriations Act of 2021, which makes federally qualified health centers and rural health clinics eligible to receive payment for hospice attending physician services when provided by a federally qualified health center slash rural health clinic physician, nurse practitioner, or physician assistant who is employed or working under contract for an federally qualified health center or rural health clinic but is not employed by a hospice program starting January 1st of 2022. Concurrent billing for chronic care management services or CCM and transitional care management or TCM services for rural health clinics and federally qualified health centers. CMS finalized its proposal to allow rural health clinics and federally qualified health centers to bill for transitional care management and other care management services furnished for the same beneficiary during the same service period, provided all requirements for billing, each code are met. COVID-19 vaccines furnished in rural health clinics and federally qualified health centers technical updates. Section 3713 of the CARES Act established Medicare Part B coverage and payment for a COVID-19 vaccine and its administration. CMS finalized its proposal to make conforming technical changes to the regulatory text related to COVID-19 vaccines for rural health clinics and federally qualified health centers. Tribal federally qualified health center payments comment solicitation. Outpatient clinics operated by a tribal organization under the Indian Self-Determination Education and Assistance Act or by an urban Indian organization receiving funds under Title V of the Indian Healthcare Improvement Act are eligible to become federally qualified health centers. Federally qualified health centers are paid under the Federally Qualified Health Center Prospective Payment System or PPS under Medicare Part B based on the lesser of the Federally Qualified Health Center PPS rate or their actual charges. There is an exception for payment under the Federally Qualified Health Center PPS for certain tribal federally qualified health centers in operation on or before April 7th of 2000. Under the exception, grandfathered tribal federally qualified health centers bill as if they were provider based to an Indian Health Service or IHS hospital and are paid the Medicare outpatient per visit rate, also referred to as the IHS all inclusive rate or AIR. CMS received a request from American Indian and Alaska Native communities to amend its Medicare regulations to make all Indian Health Service and tribally operated outpatient facilities/clinics eligible for payment at the Medicare outpatient per visit/all-inclusive rate if they were owned, operated, or leased by Indian Health Service. In addition, CMS has been asked to consider certain flexibilities regarding the cost reporting requirement for these types of facilities. Therefore, CMS solicited comment on these topics. CMS plans to further review the comments received and may consider them for potential future payment policy decisions. All right, this is the end of my presentation. Thank you for joining me. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel and leave me a few comments. Take care.